A young boy was rushed to Purple Heron Hospitals after a devastating accident. His finger had been completely amputated. For most people, it would seem impossible to restore what was lost. But in microsurgery, time can change everything. Fortunately, he reached our hospital within just 2 hours of the injury, the critical golden window for successful finger reimplantation. Without wasting a single moment, our emergency and microsurgery teams prepared for one of the most delicate procedures in reconstructive surgery. Inside the operating theater, every movement had to be perfect. Using the advanced ZEISS TIVATO 700 surgical microscope, the first of its kind in North India, our team operated under 16x magnification, allowing them to visualize structures thinner than a strand of hair. This wasn't simply about attaching a finger back. The broken bone was stabilized. Tiny arteries were meticulously repaired to restore blood flow. Delicate veins were connected to allow circulation. Damaged nerves were carefully repaired to preserve sensation, while tendons were reconstructed to regain movement and function. Each stitch demanded extraordinary precision. Every millimeter mattered. For 4 continuous hours, the surgical team remained completely focused, working tirelessly to give this young patient the best possible chance of recovery. Then came the moment every microsurgeon waits for. A gentle pinprick, fresh red blood appeared. It was the first sign that circulation had returned. The finger was alive again. What seemed impossible only hours earlier had become reality, thanks to timely intervention, advanced microsurgical expertise, and world-class technology. At Purple Heron Hospitals, we believe trauma care is about much more than saving a body part. It's about restoring function, preserving independence, and giving patients the opportunity to return to a normal life. This remarkable surgery was successfully performed under the expert care of Dr. Nitesh.